A lot of times what I see in the case as it progresses is inconsistency in the medical records in terms of complaints. It's very important that when the clients go to the doctors, that they start at the top of their head, they go down to their feet, and they describe the parts of the body that bother them. And it's very important that they are consistent throughout the course of their treatment. Insurance companies are very good about picking apart the medical records.
Inconsistencies.
The inconsistencies. So for example, if you were to go to a doctor and describe to your first doctor that your complaints were your neck and your back, and then you went to another doctor and you explained your injuries as your back and your right knee, the insurance company will really hone in on that. They have literally an army of people who scrutinize these records.
One of the best ways that we found to counteract that clients have found really worked for them, is to keep a written list, either on paper or on their phone. You know, if you're a technology person, use your phone. If you're not, then use the paper. And try to refer to that list at least once a week, because it's so easy for us as humans just to adapt. You get used to the pain, you get used to living with it, life has to go on, and you forget. And there's a lot of big ticket items that people don't realize need to be on that list. Are you having trouble sleeping? You know, is it difficult to vacuum? Can't sit in the car and you have a long drive to work every day? And we're not saying to not add additional injuries as time goes on, because sometimes new injuries do come up. As one improves, you notice another thing that you didn't notice before, or just one thing tends to lead to another. But just try to keep a written list so you can be consistent, and it's your responsibility to go over that with every medical provider on every single visit. So if it doesn't get into that chart, you're not going to get treated to get better, which is our #1 goal. You're also not going to get paid for it by the insurance company. And that's one of the only things we can't do for you. We can't go to the doctor for you, and we can't give them that list. You have to be responsible for that, and that's just one of the most crucial things that you can do as a patient.
Focusing again on our clients' communications, conversations with the doctors, it's very important that they give an accurate history.
Yes.
This is another area where insurance companies are really scrutinizing the records. So for example, kind of using you as an example, if you had a neck injury as a result of a car accident, the doctor is going to ask you if you had any prior similar complaints or any significant events in your life. If you had prior neck complaints, it's very important that you be honest about it and you disclose it, because if you had a prior similar injury and you do not give an accurate history to the doctor, that is going to seriously harm your case, because the insurance company is then going to go to the doctor and say, well, you know, doctor, had you known that Monica had this prior neck complaint, might your opinion have been different? And the doctor at that point is kind of stuck, because the doctor has a reputation to maintain, and the doctor is going to essentially say, yeah, had I known that, it might have been different. So the way to handle that is, #1, make sure that the clients are giving you and me an accurate history at the very beginning of the case. If there is something unusual about your history, maybe you've had multiple surgeries or slip and fall accidents which have led to very similar injuries or caused very similar injuries to the injuries that we're currently representing you for, we can help you in describing those prior incidents to the doctors. But we want to make sure though that the clients fully understand that an accurate medical history is critical, because we can deal with everything, we just have to know about it.
Yes, we need to be able to cut it off at the pass in the beginning and get everything on the right track from the get-go. And don't be embarrassed about what happened to you in the past. Don't be reluctant to share with us or your physicians what happened before. You know, it's rare that we see anybody out there who's had nothing wrong with them ever before.